On September 9th, 2020, the Wall Street Journal published an article entitled, "The Doctor Won't See You Now." The article, which was in favor of the increased use of nurse practitioners in healthcare, made some inaccurate remarks, like saying that studies have suggested the quality of primary care provided by nurse practitioners is as good or better than care by doctors with comparable outcomes at equivalent or lower costs. Now, we know that that's not true. It's something that we've revealed in our book. And the truth is that every study that's ever been done, which has included nurse practitioners, has been done under physician supervision. So I wrote a letter of response to the Wall Street Journal that I'll share with you. What I wrote was that I'd like to respond to "The Doctor Won't See You Now" on behalf of Physicians for Patient Protection, a grassroots organization of over 12,000 physicians. Studies that show equivalence in care between nurse practitioners and physicians are flawed. The largest comprehensive review of the subject analyzed 18 studies comparing nurse practitioner care to physician care. The studies had small sample sizes and short duration of follow-up, and only 3 were completed in the United States. Every study reviewed involved nurse practitioners working under physician supervision. Most excluded high-risk or complex patients, and several studies had high degrees of bias. Not a single large-scale study has compared the care provided by nurse practitioners practicing independently without physician supervision. So that was the letter that I sent. And a few days later, the Wall Street Journal published a rebuttal to my rebuttal by none other than Mary Mundinger, the veritable godmother of nurse practitioner practice. And this is what Dr. Mundinger wrote. "There is no room for misinformation in any debate about nurse practitioner and physician comparability. Rebecca Bernard argues that, quote, studies that show equivalence in care between nurse practitioners and physicians are flawed, and that, quote, not a single large-scale study has compared the care provided by nurse practitioners practicing independently without physician supervision. Dr. Bernard is wrong on both counts." In 2000, the Journal of the American Medical Association published an article written by the chairman of the Department of Medicine at Columbia University, the chair of the Columbia Presbyterian Medical Center Physician Contracting Group, several other eminent physicians, and me. The article was a report of a randomized clinical trial, which is the gold standard for medical research evaluation, of more than 1,300 patient subjects over 2 years that showed that nurse practitioners could provide the same care and achieve the same health outcomes for patients as care delivered by physicians. Columbia Presbyterian Medical Center authorized full admitting and discharge privileges for the NPs, and New York State gave them full prescriptive privileges, so the parameters of the comparison were valid. Numerous strong research studies from other practices have since been published in premier journals confirming these results. So today, we're going to discuss the study that Dr. Mundinger references, and we're going to evaluate whether or not her claims are true. And there is no one better to break down the study and provide background information than my 2 co-hosts who have extensively researched this topic.